Good morning, everyone. We're going to get started in this amazing historic moment. So happy to be here, and especially happy to welcome the mayor. And I want you all to know that during the darkest moments in March and April, I was on the telephone with the mayor 10 p.m., 11 p.m., midnight, 1 a.m., 2 a.m., and what his concern is. Tell me about Elmhurst. How much equipment do they need? What is the ventilator situation? How many patients are there? And the work was all about how do we get them the staff they need? How do we get them the supplies they need? He very much felt the pain of Elmhurst. I know he was here a number of times during that period. And I want to thank him deeply for that effort, for that caring, and how great that now we could be here to make the pain go away, to be able to protect the heroes of Elmhurst. So, Mr. Mayor.
Thank you, thank you. I want to thank Dr. Mitch Katz, who really has seen through this whole crisis, our extraordinary public hospital system, public clinic system. Health and Hospitals has borne the brunt of the coronavirus crisis. The men and women of H&H have done an amazing job fighting back this disease and deserve all the respect and appreciation in the world. And they had a great and persistent leader during it. So, Mitch, thank you from the bottom of my heart for all you did for this city during this crisis. We're here at Elmhurst Hospital, a heroic place, a place where something extraordinary happened. One of the toughest battles anywhere in the United States of America against the coronavirus happened right here. But Elmhurst Hospital held. Elmhurst Hospital held the line. The men and women who worked here, the healthcare heroes, did an extraordinary job against all odds. That's the story of Elmhurst Hospital. There's a lot to be proud of. You can clap for that. You can clap for that. Elmhurst Hospital has a lot to be proud of. Queens has a lot to be proud of. It is a great pleasure to be here with the new Borough President of Queens, Donovan Richards. Congratulations. And Donovan, you chose a good time to become Borough President because we're celebrating such an important moment here. The first ever vaccination at a New York City public hospital. And there's no more fitting place than here. This is the place where it should be, because this is the heroic place. I really want to emphasize that this is the heroic place. And I will tell you for the rest of my life, when I hear the words Elmhurst Hospital, I'm going to think of heroes, and I'm going to think of a battle that was fought and won. That's what I'm going to remember. So Elmhurst is part of what I can say with assurance is the leading public health care system in America, H&H. And this is the first, and we can say that for sure, can't we? And we're going to see the first vaccinations in an H&H facility. And the good news is you're going to be seeing more and more people every day getting vaccinated. In the last 48 hours since the vaccine arrived, over 1,600 healthcare workers have been vaccinated in New York City. That is a huge step forward. Now, why are we here? We're here to honor our healthcare workers. We're here to honor Elmhurst Hospital. We're also here to talk about how important our public healthcare system has been in this year. I'm going to be blunt. For a long time, HHC, then Health and Hospitals, were ignored in this city. They were too often put down, too often starved of funding. And a lot of folks, unfortunately, thought of H&H as something that wasn't their business. And H&H struggled for years and years. Several years ago, before we ever heard the word coronavirus, we made a decision to invest in H&H, billions of dollars, to make sure our public health care system was strong. We made a decision that the future of New York City depended on H&H. No, we did not have a crystal ball. We did not know there would be a pandemic. We knew people needed health care. And we knew it wouldn't happen without H&H. So we spent billions of dollars. And let me tell you, that is some of the best money we ever spent. Because we needed H&H more than we ever knew. And when that moment came, when literally the city was on a razor's edge, H&H was there for thousands and tens of thousands of New Yorkers. H&H held the line. H&H Health and Hospitals saved New York City. And in this next battle, and this will be the last great battle against the coronavirus, I'm happy to tell you, this will be the last great battle against the coronavirus because the vaccine is here. We will need H&H again to help us fight back and defeat this second wave, but also because this is the place where so many people will get vaccinated. This is the place where neighborhoods will turn and will trust to come get that vaccination. So it's all going to be happening here. And that's why we're here today, to celebrate this important step, this crucial, wonderful moment. Let me say a few quick words in Spanish before this historic moment occurs. La salud es un derecho humano. Y nuestros hospitales públicos están aquí para proveer ese derecho. En estos edificios se han peleado duras batallas contra el virus. Y aquí mismo vamos a pelear la batalla final. Millones de neoyorquinos van a recibir una vacuna segura, efectiva y gratis en nuestros hospitales para acabar de una vez por todas con esta pandemia. Let's make this pandemic part of our past. Let's get rid of it once and for all. And with that, I will now tell you, we're so pleased to be here with Veronica Delgado, who is a lead physician's assistant in the emergency department, and William Kelly, a service aide in the environmental services department. And to assist them, Dr. Eric Way and Dr. Dave Choksey, Dr. Eric Way of H&H, Dr. Dave Choksey, our health commissioner, have stepped forward. And you have office jobs now, but you still know how to doctor. So get ready for the big moment, everyone. Come on, everyone. This is a standing ovation. It doesn't get better than this. You didn't play. You didn't play at all. Well done.
Down for a strong.
Thank you.
I didn't feel it at all.
Didn't feel it at all.
And it wasn't embarrassing at all.
We're going to be here for all your medical appointments. Come, you both did a great job.
We're going to do a short Q&A.
All right, everyone. First of all, again, to William and Veronica, it is not typical to have 100 people in the room for your shot. So you both did an incredible job staying cool under pressure. And thank you. Thank you not only for being an example to the whole city of the fact that this vaccine is so important and so safe, but thank you for being part of the Elmhurst family. This family of heroes has done so much. Let's thank them for all they do. All right, we are going to take some questions. Yes?
Mayor, you talked about 1,600 healthcare workers vaccinated in the last 2 days. At that pace, and correct my math if I'm wrong, that's 800 a day. Over the course of a month, that would be 24,000. Don't you need to rapidly accelerate that pace to make any kind of dent in the population, healthcare or otherwise?
Yeah, Andrew, just as this was just day one, day two. Do not take that for a second as an indication of where things are going. I'm going to have Dr. Choksi speak to this, but you're going to see things expand very quickly. Our healthcare team had to obviously get to know this vaccine, get used to the details of how to handle it. But you're going to see a very, very rapid expansion, and as soon as vaccine comes in, it is going to get distributed, it's going to get used very quickly. Dr. Choksi, you want to add?
Thanks very much, Mr. Mayor. Yes, just to add briefly to it, remember 37 hospitals received their first deliveries yesterday. Amazing to see many of them actually began their vaccinations yesterday as well. Many others will begin them today. So we do expect that clip to pick up. But remember, just as what we emphasize with a vaccine is that it is safe and effective, we want the vaccination process also to be safe and effective. And people are making sure that the way the vaccine is transported and stored and all of the protocols are very rigorous, particularly in these early days. We want people to emphasize that so there's not a single vaccine that is wasted, but we do expect those numbers to pick up. Just as a quick follow-up, how high, what is the number you want to see in terms of vaccinations per day to begin making a difference? Well, we will start to think about those goals with respect to vaccinations per day. So much of it depends on the supply of the vaccine that we receive to New York City. But our general principle, particularly when the supply is very limited in these early days, is to try to get it as quickly as possible into people's arms so that they can start to build immunity.
Yeah, Andrew, I really do appreciate the question because I think it's important we show people how much impact it's going to have, but I want to be clear. Right now it comes in, it goes out. As soon as it comes in, turn it around, get it to hospitals, get people the vaccinations they need. It's really about making the movement of this as quick as possible. Over time, and when we see all the different vaccines, because we're waiting for the final approval on Moderna, I think Johnson & Johnson is out there, we'll have a sense of what our actual daily supply will be. But for now, it's like as soon as it comes in, goes right back out. Yes?
Can you talk about any side effects the first 1,600 people have had, and or maybe what you're hearing from around the country?
Sure. Well, the most important thing is that we have not heard of any serious adverse events. That means very serious side effects in New York City thus far. We are in contact with colleagues at the CDC as well as other health departments around the country to make sure that we're understanding what they're seeing as well. Thankfully, no serious adverse events have been reported thus far. The side effects that are being experienced are the ones that were also seen in the studies for the vaccine, particularly some pain at the injection site, some fatigue, some muscle aches. Generally, those only last for the first 24 to 48 hours and are mostly mild side effects.
We're watching, hold on one second, we're watching William and Veronica very closely now. Any side effects so far? No, you're doing good. They're both answering, it looks good. Did you have a follow-up?
I did. It was a follow-up to Andrew's question. Is there any plan to publish a dashboard so that the public can see how many people are getting vaccinated every day?
Yes, and that will be done by our command center. So that's going to be coming out in the next few days as those numbers get clear. Go ahead, Katie.
Could perhaps Dr. Katz talk about the distribution of the vaccine within the city's public health hospital system? Is it equitable to that of private hospitals? Are there limits? Just to see, I know we saw NYU and Northwell get it on Monday. I'm just curious if there's a distribution, if there's an inequity within that.
Sure, happy to answer. The very small number of hospitals, only about 5, received it on Monday. The bulk of hospitals, including all the H&H hospitals, received it yesterday. And there are still a few that are receiving it today. So we were in the middle large tranche. And in terms of supply, as the mayor has said, ultimately, we need a much larger supply, and we think that's going to come in the next weeks, especially with the second vaccine likely to be approved. Right now, in terms of distribution, we're focusing on people in the highest risk areas, people who work in the emergency room or the ICU, as these two great healthcare workers are, and are also over 60. So that we're able to, which they may not be, but which but we want to get the highest risk people. I have to do 2 quick shout outs. Danielle DeBerry has been worked all weekend to set this up. She's our chief pharmacist. She put together all the protocols, all the sign-ins. And I can never pass. Dr. Mashapur is our chief medical officer, 50 years at Elmhurst. 50 years.
You've been working at Elmhurst for 50 years.
Yes, good.
That's beautiful. Let's give her another round. Go ahead, Katie.
As a follow-up, do we have numbers, looking at Elmhurst specifically, how many healthcare workers here at Elmhurst will be vaccinated by the end of today, by the end of the week, and so on?
What I can tell you is that from looking at the numbers, I believe we're going to vaccinate the whole hospital in 3 weeks. Everyone in every single unit, just starting at the highest risk units.
Okay, who else? Yeah.
Mayor, I want to ask you, since we are here at Elmhurst, and this was so much the epicenter of what we saw in the spring, how are we doing today as we see numbers slowly go up? Hospitalization rate here in particular, capacity here, patient load, and just in general testing-wise as well?
Yeah. Couple different things quickly. It's a mix for sure. The amount of testing is good news. Now we're going to have the capacity to be up to about 120,000 tests a day in New York City. We still need people to go get those tests. We have rigorous testing in the schools. Obviously, that's constant, but we need everyday New Yorkers to go get tested more. So that's an area where we can do better. Positivity levels too high. There's no question about it. I'll give you the update for the day with the indicators. Well, I thought I had the indicators in front of me. Hold on, I may need that on another card because I don't have the indicators in front of me. We'll get that over 1 second, guys. Just write it out and hand it over. But the point is today's indicators, the positivity level is too high. It's not going in the right direction. Hospitalizations are increasing. Our hospitals are doing a lot better, but meaning they are better able to handle the coronavirus than they were, obviously, in the spring. But the hospitalizations keep increasing, and I'm worried about that. So it's a reminder to all New Yorkers, we really need people to get tested. We need people to keep wearing the mask. We need people to not travel, keep gathering small, because there is increasing pressure on our hospitals. And, right now, as the governor has said, and I have said, if we don't see a turnaround, there will have to be deeper restrictions. And it would potentially have to be a full pause. And if people want to avoid that, it's important to really double down. Get tested, wear a mask, don't travel, avoid the gatherings. That's the best way to fight back the virus, link up to the better times when we have the vaccine more fully distributed, and avoid any kind of shutdown. That's the only way we're going to do it, is if people really step up. In terms of hospitals, how they're doing,
Right,
Dr.
I'll
Katz,
do it.
Dr.
So
Chauncey?
I think the mayor has covered the top lines. We have about a third capacity available, both the ICU and in the regular beds. So we're in reasonable shape. Just to give people a sense of the numbers, all 11 hospitals together today have about 280 people with COVID. At our peak, we got to almost 4,000 last April. So, 280, it does strain the system. We haven't seen the huge drop in non-COVID patients that we saw in March and April, which we're happy about. We realized that there was tremendous care that was lost. People who were seriously sick stayed away from all hospitals in March and April. All the New York City hospitals experienced a huge drop. That hasn't happened now, and so we have to watch capacity closely. But we're being able to bring in additional nurses starting on Monday, and we believe we'll be able to keep up with the increase in cases that the mayor has spoken about.
Dr. Chauncey, you want to add?
I'll just add briefly in terms of what we're seeing with respect to the citywide phenomena. It really echoes what Dr. Katz just went through, which is certainly we're concerned for the reasons the mayor has laid out in terms of the increase in cases and percent positivity, because we know that does lead to an increase in hospitalizations. But thus far, hospitals are able to keep pace with that upsurge, and it's up to us to blunt the curve further with respect to those key public health actions that will allow us to reduce the burden on our healthcare system.
Okay, who else? Yes.
Speaking of testing, COVID-19 testing is going to be stopped for no-related reasons at health and hospital locations starting today to resume tomorrow at noon. Are you concerned about having to take the testing offline for almost a day, given the weather-related reasons and any consequences?
Look, obviously, I wish we didn't have to, but this is just a smart precaution. I think it's going offline at 2 o'clock today.
That's correct.
2 o'clock, back at noon tomorrow. It's under 24 hours. I don't think it'll make a huge difference, obviously. But this is when it gets complicated, right? A snowstorm coming. We want people to be safe. We want people to take precautions because they need to take the storm seriously. We obviously always want to get people tested. But I think when it's a brief window like this, it should have a limited impact. Go ahead.
Yes, and more about your vaccine distribution. I understand you commented yesterday that you're not expecting the snow to have any impact on the vaccine rollout across the city. And just wanted to follow up on that a little bit more. I think we also got the update around 41,000 doses of the vaccine were available yesterday. It sounds like more and more are coming in almost daily. Can you give us a better sense of how many shipments you're expecting today, tomorrow, over the next 48 hours? And how can you say that the snow is not going to impact that distribution?
Yeah, fair questions all around. So I want to first frame it real quick. This vaccination effort is literally in its infancy. We were not even sure until the end of Sunday, beginning of Monday, exactly when the arrivals would begin. So we're just days into it. The hospitals are learning how to use the vaccine for the first time, as Dr. Katz and Dr. Chauncey have talked about, never had a vaccine like this before. You're going to see a constant ramping up. But in the meantime, the question of the storm, what does it mean? Well, it's a storm, but it is a storm so far still staying in a pretty limited range, that kind of 8 inches to 12 inches range for a limited period of time this afternoon, evening, into early morning hours tomorrow. That doesn't change anything in a big way from what we're seeing. We expect to keep getting the deliveries and keep being able to turn around and get people vaccinated. I think everyone, again, I never ask New Yorkers for patience because we're not a patient people. I do ask people to recognize there's no one with more motivation, literally no one in New York City with more motivation to get these vaccinations to happen quickly than our healthcare workers and our healthcare leaders. They want to get this done. They're going to move this very, very aggressively. But the storm at this point does not present any meaningful change to our schedule. Hey, real quick on the indicators, everyone. So let me do this. Hospitalizations for the day, the 195 new hospitalizations. COVID positivity, 56% among them. And then the hospitalizations per 100,000, that's at 3 now. So that's gotten consistently higher. So again, another example why we do have a problem with these increasing hospitalizations, and we got to fight back against this. The new cases combined, confirmed, and probable 2,785. 2,785, really big number, another cause for concern. Positivity on a 7-day average, 5.71%. So higher than we want it to be. That number has not been shooting up, thank God, but is definitely higher than we need it to be. Who has not gone yet from the media? Let me see if anyone hasn't gone, just for a second. Go ahead.
Hi, so I just want to hear a little bit more about Veronica and William, where you reside, what you're feeling, any messages you want to send to, to both queens.
Well, right now, I feel good.
You look good. For someone over 60. We're going to correct the record, right?
What exactly is your age?
Okay.
I would say.
What exactly is your age?
You can lie.
If you want to share a quick any messages you want to send to
You want to know my age?
Who's asking?
Just say old.
No.
I'm young.
What's your message to the community? What's your message to people who've been waiting for the vaccine?
Well, I guess everybody's been waiting for so long, so that's why I wanted to do this.
And Veronica?
Yeah, I'm 65.
You don't look
Everybody,
it.
we're all 65. I feel very privileged to be one of the first to get the vaccine. I know there are people that are more frontline and more deserving, so my message is to the mayor and everybody. I hope that everybody can be vaccinated quickly.
Yeah.
And my message to non-healthcare providers is also, you have to do your own research and everybody has to make their own decisions, but not to be afraid of the vaccine and not to get information off of Facebook.
Good advice. You win quote of the day award right there, okay? We've all learned a valuable lesson. Okay, last call. Anyone who has not asked a question from the media? Okay, final one.
Well, that was just going off of what we were just talking about. Both of you had seen so much of what happened in Elmhurst. I'm sure this is something, that experience is certainly something that won't leave your memory anyhow. Just taking that into account and taking today into account, what just happened, and you getting your vaccine, can we talk about that feeling and maybe some personal notes of what persuaded you to get that?
Quite frankly, I don't know a healthcare worker in this hospital who doesn't want the vaccine immediately. So I don't think it's anything unusual for people to want it. What it feels like to me is like that first bit of sunlight in the morning after a very long, dark, and frightening night. Honestly.
Nicely said.
And so I guess that's it. Yeah.
Well, to me, I hope everybody takes the vaccine shot, I mean, it's good to take it, things like that. So I hope everybody in the whole world takes the shot, so we can all get back together. Okay? Next question?
That's good. But thank you to Veronica and William. And William, that last line is very powerful. Let everyone get the vaccine so we can all get back together. That's a beautiful thought, so we can all get back together. I also want you to know, William, Veronica, you've really done a great job today, and we're going to reward you with a candy cane. This should become part of, hold up your candy cane so people know what I'm talking about here. This should become part of the vaccine protocol, okay? You get a candy cane with every vaccine. That will encourage people. Everyone, congratulations, Elmhurst. Well done.
The folks in media, you can follow Joe. There's going to be some colleagues outside. They're going to be greeting Veronica and William. So if you want to head outside, follow Joe. And we're going to hold here for a second.
An amazing job.
All right, if you guys want to get a quick shot.
No.
I'm from Jamaica.
So William Kelly, the service team, department.
Wow, bless you. Now it's tough time to do Brazil out here.
Yes. Veronica Delgado, D-E-L-G-A-D-O, and she's the lead of physicians.
It was tough, my fault.
All right, cameras.
Thank you, sir.